In the access cavity, it's important to review our well-angulated preoperative films. We need to observe the relationship between the clinical crown and the underlying roots. We need to see if we can visualize the pulp chamber. And then within the pulp chamber, do we see stones? Great ergonomics and organization facilitate the flow of treatment and keep our patients more comfortable. Looking at the occlusal view of the isolated tooth reminds me of an old expression. Start with the end in mind. The outline pattern can be used to guide our clinical actions. Since we're preparing an access window through a metallic crown, we use the transmetal burr. Lay the head of the handpiece over to get it out of your line of sight. Try to penetrate through the gold as quickly as possible. Transmetal burrs, when they're used on their ends, skip and they dance. And so, try to cut through the metal so you can use the side of the burr. The side of the transmetal burr has a special sawtooth configuration that reduces vibration and rapidly removes metal. Use the transmetal burr to complete the outline pattern through the gold crown. Once that's accomplished, we can go to the surgical length carbide number 4 round burr. Use it like a brush and sweep back and forth. Notice we're using no water during this procedure because we're not trying to protect the pulp, we're going to be eliminating the pulp, so this improves our vision. The Explorer demonstrates the initial entry into the pulp chamber, traces the expanding outline pattern, and confirms the access preparation is on axes. Let's go back to the 4 round burr and do a little bit more removal towards the pulpal roof. You can see quite an island that appears to be quite a large denticle. Notice the color distinction between this large stone and the surrounding dentin. Sometimes you can just elevate these things out with a Explorer, but if they're large, then you better do more access refinements. A surgical length tapered diamond is used to smooth up the axial walls and make them nice and flat. This refracts light excellently and improves vision. Ultrasonics is an excellent way to blow out a lot of these big stones and free them up so they can be liberated. You can see this thing is large, not only in terms of its mesial, distal, buccolingual dimensions, but notice its thickness. Once the stone's liberated from the pulp chamber, diamonds are used to progressively refine the access. Notice the angle of the Explorer. This lets us know a little bit more about the underlying anatomy. Many dentists regretfully begin to instrument canals at this point. For me, there's still quite a bit of work we can do to set up our cleaning and shaping. Here's a free denticle. These can be teased up and blown out with air. And sometimes there'll be projections of denticles extending down into the canals. If we're careful, we can tease these up as well so that it'll free up the canal so we can begin our clean and shaping. Tin files are used for a couple reasons initially. First of all, we might be able to pull up another stone, which can open up the orifice level, but also the angle of the tin file gives us some sense of appreciation for the angle of the canal coronally. Gates Gliddens are used at low speed. The head of the handpiece is moved in a big orbital arc to flare the orifice so that it can receive files passively and easily. Use the belly of the Gates Glidden on the axial walls. Microscopes, in combination with ultrasonics, allows us to perform microsonic techniques. Notice the assistant using continuous air as we sand away tooth structure precisely. This gives us an unobstructed line of sight. When using the endo tip number 3, set the power on the P5 at about 6 or 7. Notice how we have unobstructed vision into the mesial aspect of the pulp chamber. We're not looking at the back end of a bulky handpiece. Use this in a painting brush-like motion. Here we've uncovered an extra orifice between the MB and the ML orifices. When the tip of the file engages, we get handle flutter. Smaller Gates Gliddens can be used like a brush, using their bellies to remove a little bit of dentin towards the MB line angle. This allows a tin file to slide smoothly down the axial wall and transition into the orifice. This is a great opening for cleaning and shaping. When we refine our pulp chambers with ultrasonics, we set the stage for more predictable cleaning and shaping procedures. The finished access cavity can be topped off with an appropriate irrigant, and this sets the stage for scouting the canals. Let's look at an access cavity of a maxillary molar. This first molar has a fistulous tract that's being traced with a gutta percha point. Notice the crown extends gingivally and we cannot identify the pulp chamber. Access cavities need to be well planned so that we can avoid iatrogenic events. Again, we're looking at the occlusal view of the isolated tooth. In this instance, it's a porcelain fused to metal crown. The outline pattern guides our clinical actions, but in a maxillary first molar, we need to be aware of the presence of the MB2, which is present over 90% of the time. Therefore, our access cavity needs to expand at the expense of the mesial marginal ridge. The rotary cutting tool of choice is the round burr diamond. Voluminous amounts of water is used continuously as we begin to paint like a brush on the porcelain surface. Light brush cutting action eliminates the potential for fracture. As we paint with the diamond, we'll begin to see the underlying substructure. Be sure to take your time, don't be in a hurry, and lay the head of the handpiece over towards the mesial. This will give you a line of sight so that you can watch the burr work. Sometimes I like to drag the axial walls up just a little bit more to give me better access and visibility into the chamber. The transmetal burr is laid over on the side, as we've previously mentioned, and it's now cutting on its side. Once we've penetrated through the metal, we go to the surgical length carbide number 4. Again, notice the line of sight down the shaft of the burr. We can always watch the rotating head cut, and we're using that head like a brush, painting buccal, lingual, and mesial to distal as we progressively move closer and closer to the roof of the pulp chamber. At a higher magnification, you can see that we've just broken through the pulpal roof towards the MB. The Explorer demonstrates the initial entry into the pulp chamber. This site is where we'll place the number 4 surgical length round burr. We drag up, and as we lift the head of the burr up, we de-roof the pulp chamber progressively, and we continue this until the roof is completely removed. Notice this leathery tissue that's occupying a portion of the pulpal floor. Following the use of carbide round burrs, the axial walls are irregular. Therefore, we can true up these axial walls with a surgical length tapered diamond. A trick I found useful is to use just the coronal 2/3 of the cutting grit to expand the access cavity. This keeps the end of the diamond free from gouging in and ledging the internal walls. Once the access cavity has been expanded, then we can use the apical 1/3 of the diamond to marry the axial walls with the pulpal floor. Slightly adjust the patient's head so you have an excellent line of sight into the pulp chamber, and importantly, so you can watch just the coronal 2/3 of the diamond work. The tip of your diamond wants to be free as you sweep back and forth on the mesio-axial wall. As you ramp around the line angle from the MB to the buccal, be sure to keep the free end of the diamond off the pulpal floor. Use the diamond like a piece of sandpaper. Lightly carry the diamond around these internal walls, just sanding away and refining until the axial walls become nice and flat. This refracts light and gives us excellent added vision into these deep pulp chambers. The Explorer is pointing to the DB, the MB, and the related groove, which commonly holds the MB2. And of course, we also have a palatal orifice. The tin file is inserted into the DB, not to begin cleaning and shaping, but just to observe the relationship of the file to the long axis of the canal. As we slide the instrument down the distal buccal line angle, it hangs up a little bit on an outcropping. Remember, the pulpal horns extend out towards the buccal and create a shelf of dentin. Gates Gliddens can be used in an orbital arc to face off and flare the orifice. We use the belly of the GG to further refine and blend the coronal aspect of the canal into the axial walls. This allows the instruments now to pass easily down the wall, slide into the orifice to initiate clean and shaping procedures. Again, a hand file can be used to ascertain the long axis of the canal. Notice how the handle's off axis. Flexible Gates Gliddens can be used like a brush, and we can paint with the belly of the GG to remove restrictive dentin. This is done very precisely and carefully on the outstroke. We can lay the belly over towards the MB2 and refine that area as well. Once we've done a few painting motions, we've improved access, and now the 10 file can slide easily down the MB line angle into the MB system. The Explorer begins to map out the anticipated location of the MB2. Sometimes calcific tissue can be freed up, but generally this is an area that needs refinement. Ultrasonics is an excellent way to remove precise amounts of dentin. The entry angle of the MB2 into the pulp chamber is very acute. By removing two structure at the junction of the axial wall and the pulp chamber floor, this will give us a better straight line approach into the MB2 system. Again, sand, carrying the ultrasonic instrument in a brush-like motion to remove selective amounts of dentin. Since all ultrasonic work is performed dry, we need to irrigate periodically to remove the debris that's accumulated in the pulpal chamber floor and specifically in the groove off the MB1. Notice how the 10 file slides effortlessly down the mesioaxial wall and into the MB2. Following ultrasonic work, you can see that we've even improved access by noting the position of the handle of the 15 file standing up straight and tall.